Hello, my name is Dr. Marlene Maheu, and I am a psychologist in the United States. I am here to talk with you a little bit about the two organizations that I am very proud to be affiliated with. I am the CEO of the Coalition for Technology and Behavioral Science, otherwise known as CTIBS, and also the Telebehavioral Health Institute, which is known as TBHI. I am delighted to tell you that we at CTIBS have affiliated with Salud in trying to work together to organize as much as we can of an international effort for research and training. CTIBS was founded in 2011 when a group of us from a number of different professions decided to try to work together to advance the field, because larger associations in our country could not move quickly. And at the rate that technology was evolving, we were quite concerned that clinicians would not be able to grasp what they needed to grasp in a way that would be safe for consumers. So we formed the Coalition for Technology with a mission of creating responsible, legal, and ethical interventions that are accessible to the worldwide behavioral community. Now, we use the term behavioral because the federal government in the United States several years ago decided to move away from the terms mental health and substance abuse and to combine the effort. They were in two separate departments before. Now they are all in one, and rather than calling them those terms, they're now calling all of that behavioral. Well, by default then, anything tele across distance is known as telebehavioral health. We see there are many other terms that are used in a variety of places, but we're going to stick with the telebehavioral health terms throughout this talk and also in the work that we do. But we formed as an interprofessional, meaning across different types of professions, in 2014 as a nonprofit. So we officially became an organization in 2014. And at that same time, we decided we were going to look at competencies for the field because nobody had done that yet. And we were able to work with some people from the Veterans Administration, which is it's actually the largest employer in the United States, and it takes care of people that have gone off to the wars. So veterans and their families a lot of times are involved as well. So they have the largest budgets and they have a lot of research that they're able to work on. And so we decided to follow their models for competencies, but to apply them for behavioral health care using technology, so telebehavioral health. A couple years later, we decided that we were going to work on a journal, and we were approached by Springer Nature, who then decided to fund us for a journal, and we formed the Journal for Technology and Behavioral Science. We've been in operation 3 years now, and we have a number of publications that are recognized, and so we're very excited about that. And we are very interested in extending our journal to an international professional community. So hopefully you'll be aware of it and submit some papers to us. We, in 2017, published the framework for the interprofessional competencies that I mentioned that we started in 2014. It took us quite a while to pull together the competencies. We developed a lot of early papers on it, and then we disseminated that to various decision makers as well as professional associations here in the United States and Canada to try to get some opinions about what different groups had thought about what we were trying to do. And so we pulled all of that together again. It took us a year to compile all of that. And we were meeting pretty regularly. We were meeting every couple of weeks for a couple hours, about 2 hours. So it was a very intense labor of love. And then we published them in 2017. We've since written a number of different papers. I'll show you quickly some titles in a few moments, but the latest thing that's come of it is a book for graduate students. And that's just going to be released next month, actually. So that is my 5th textbook in the field. And also, I'm very excited to be focused this intensely on telehealth. The other aspect of this is now we're going and writing profession-specific articles. We just published one for psychiatry. We are working on one for psychology and another one for marriage and family therapists. And we hope to be getting some more in counseling. And we actually just are negotiating one right now for social work. So what we want to do is look at the competencies, but in more detail through these articles. I'm just going to take a moment to explain to you how things are set up in our country. So maybe you can see how competencies fit into our picture, but maybe this is true in your country as well, or maybe it's different, but I would be very interested in knowing how you're set up and how you might be interested in using competencies. So in our country, legislators work together and they make laws. And then the law gets a statewide law, and then it is interpreted by different licensing boards called regulatory boards, and they regulate how we work. In Canada, they're called registration boards, but Canada is very much set up the way the United States is. And those boards give us our license. The professional associations come up with ethical codes, but they don't control our license. It's a completely separate thing. So they may lobby, they may try to get the attention of the licensing boards and try to help us with the licensing boards, but they are not the licensing boards. So they're two separate groups. They come up with ethical codes, they come up with guidelines, they have not yet come up with competencies. So that's where we thought there was something very important that was missing. So we decided to develop the competencies. Now, the reason we did that is that training in the United States should flow out of competencies. The federal government in the year 2001, through the Institute of Medicine, the IOM, decided that to publish a series of papers saying training really should be based on someone thoroughly looking at the evidence and then coming up with competencies, which basically are the amino acids of the training world. So the little building blocks, kind of where the life is. And so the competencies that we came up with are measurable, they're discrete, so they don't overlap, or they overlap minimally if they do, and then training can then be based on these competencies. And out of training then should come clinical care. We should not be, in our country anyway, offering services to people without an evidence base and having taken some training to make sure that we completely understand the evidence. I think the best example that I can give you is that for someone who's an alcoholic, they may be very well acquainted with their own alcoholism and what they went through, but they, in our country, have to take a course to look at various etiologies of alcoholism, different sources of alcoholism, and then come up with intervention models based on the etiology, where that type of alcoholism comes from or how it's best understood. So the interventions are based on the etiology, the origins of it, rather than, oh, this works for everybody. One thing works for everybody, because there's all kinds of alcoholism and all types of people that suffer from alcoholism. So training then is seen as essential before people go and deliver clinical care. And the regulatory boards require additional training through the years as you maintain your license. So that's kind of how it's structured in our country. Now, what we did at CTIBS was look at the competency level and say, all right, what are the big buckets? What are the domains that we need to address? We found 7 of them. We then have come up with objectives, kind of general goals for each of these buckets, these domains. And then out of those goals, we developed some competencies. And then, of course, training is the separate world. The CTIBS does not get into training. It just does the research that then fuels the development of training by other groups, hopefully. So I just want to give you a little rundown of our research. We've done a number of papers. The first one, as I mentioned earlier, is 2017, is looking at the competencies. And the first paper we wrote was the need for a framework, an interdisciplinary framework. Then in 2017, again, we published, at the end of the year, we published our document saying, okay, first paper said we needed them. Now here they are, we've delivered them. And that was a 4.5-year project. It was very, very thorough. We tried to be as thorough as we could be. And then we had to correct it. There was a problem with the publication of it, so we had to correct it. But so that was in 2018. And then you can see we have other documents that have flowed out of that over the years, and we continue to publish more. So there again, I want to invite you to think about this for your country, and if there's any way that you'd be interested in working with us, we'd be very interested in working with you. Now, just to get into a little more detail about the competencies, I'm going to take one domain and just explain it to you. There are 3 different pieces to it. One is evaluation and treatment, basically assessment. How do you assess what somebody has going on? And then how do you adapt your treatment plan for them? And then the second aspect of clinical evaluation is care, is being aware of cultural differences, diversity, and how to be respectful of that, what you need to learn about that before you can truly call yourself a professional when you work with people from a different group. And then also the documentation, the administrative program, the procedures that you approach. So if we just look at the first one out of those 3 that I just gave you, actually we did a lot of drilling down into quite some depth. Then we look at how do you assess the patient. So the first thing that you do right when you get started is how do you assess the person's appropriateness for the service. They may not have the physical characteristics needed to organize themselves, or that, that they may not have the cognitive ability to understand how to turn a monitor on and off, and how to work with a cursor, or get themselves properly positioned on a camera if they're doing video, all those kinds of things. If they're working with an app, do they have the finger dexterity to work with an app? Do they even have the technology? So all of those things go into assessing appropriateness. So you can see we're rather detailed as we go on. And then what the training institute is that I run, that I started way before the CTIBS group, is the Telebehavioral Health Institute. And actually, I've been doing this for 25 years. So I've been training internationally for 25 years. And I've trained people in a number of different countries outside of the United States, but altogether about 26,000 professionals. I'm very excited about it, and that's why I'm very happy to be talking with you today, too. In any case, we are at telehealth.org, and that's our training institute. We have about 90 hours of very specialized telebehavioral health training. That's our exclusive focus, and we have professionals from 79 countries that have already come to work with us. So we have people identify which country they're from when they come in, and so we can count them. We can say, there's people from Togo, Africa, or someone from Sri Lanka is with us. So very excited about that. We offer a credential that is called the Board Certified Telehealth Professional, and that is a 5-year credential. We help groups that need staffing professionals. They need to find professionals, and they're looking for credentialed professionals. They come to us, and we help them find staff. And we also do a lot of consulting, most of it in the United States, but also internationally. So we've worked with groups from around the world to help them set up the infrastructure in their country, for example, or set up specific training programs for physicians or for nurses or for different groups. This is a layout of our new website. This is on our server. It's not live yet. It should be this week, so maybe by the time you see this, it'll be live. But we're very excited. We have a new look and feel. And so we're telehealth.org, and we focus exclusively on training, credentialing, staffing, and consulting. In our training, we have different packages. So we have the certificates I was telling you about. We have level 1 and level 2. It's kind of small. You may not be able to see the courses, but we have 9 courses that form our level 2 training. The difference between level 1 and level 2 is that level 1 is for the average clinician that can use somebody else's paperwork or somebody else's decision-making about policy, and maybe in a hospital or a clinic or an agency, that type of thing. And level 2 is more for the decision maker, the person who needs to come up with policies, someone who needs to choose the different types of technology. So in this group, in the United States, it also includes group practice people. It includes people who are independent practitioners that need to make their own decisions about, well, should I do text messaging or not? Is it safe? Or what really goes on with text messaging? What do I need to think about? Or, well, I need to write a policy for my referrals. How do I deal with referrals? And so we have training about all of those different things, as well as clinical care and looking at that across professionals as teams, because in the United States, team-based care now is a very big focus. So that could be physicians and psychologists and psychiatrists, nurses, and all kinds of people in on a care team for somebody who may be experiencing a behavioral disorder and, let's say, heart attack. So the comorbid problems where there are multiple issues going on at the same time. Now, we at the Institute are very proud of the fact that we've been approved by 5 different groups to offer continuing education, as well as continuing medical education. So we offer continuing medical education for physicians, osteopaths, nurses, nurse practitioners, and physician's assistants. We offer continuing education for social workers, for psychologists, for counselors, and for addiction professionals. So we've been recognized and are approved providers of training that then these groups look at and say, okay, this is something that a professional can use to get their license reapproved. So every 2-3 years, different states require that professionals submit proof of education. So we offer that kind of education in the United States. Now, we've also affiliated with lots of different groups, been around for 25 years. So I've been going to lots of meetings and meeting people. And so there are a number of groups that we've affiliated with because we recognize that what they're doing is serious, and they likewise appreciate what we've done. And so we've affiliated with a lot of different groups and support each other in our mutual efforts. So I want to give you just a screenshot too of our training platform. We operate on a Moodle learning management system. Those of you that understand open source software will know that this is worldwide software, and that we have a very, very large Moodle community that is international, and we have one of the leading people in the world that actually helps us and manages our Moodle site. And so this is just a screenshot of some of our courses and how the interface is laid out. So there's this front end site that I showed you that describes our courses. Once somebody purchases our training, they come into the backside through a login, and then we can see how they did with the coursework, and then we can issue a formal certificate that they take to the licensing boards. So that's kind of how it's structured on our end. So once again, this is a very quick overview. Thank you for your attention, and I really want to invite you to work with us. I will give you my email address here. I am mmaheu@telehealth.org, and also want you to know that we are planning to have some in-person conferences with Salud to help support your efforts internationally. And the first one, I am going to Mallorca, Spain, where the founder of Salud is going to be having an in-person conference this summer in 2020. And then hopefully, if it all works out well, then you'll be able to come to San Diego, California, my home, and have an in-person conference there so we can all rub elbows and get to know each other and hopefully work together. Thank you.